There's a very high incidence of diabetes in this community. 60% of the patients at this hospital are diabetic. Patients aren't getting the kind of preventive care or ongoing care that they should have. So they show up in the emergency department, they have severe diabetes, it's out of control, and they don't have any symptoms. They don't know about it.
We already knew that we had a really high risk population here in Boyle Heights. There was a study by UCLA, and it showed that if you went to certain zip codes, the amputation rate went up tenfold. If you lose one leg, you have an 80% chance to lose the other leg in 5 years. In 5 years after that, there's an 80% chance that you'll no longer be with us. That mortality rate is up there close to some of the worst type of cancers that there are.
These amputations, they have a profound effect on people. It's depressing to lose your leg. It's depressing to lose your earning capacity.
And it's not just a physical thing that happens to them. It's also a social impact that's just really affects everybody in their family. We have an on-call team that's on call 24 hours, 365 days out of the year. We have a foot and ankle specialist, we have a vascular specialist, infectious disease, and we have an endocrinologist. And it's about providing timely and quality care.
We're treating it as you would treat a stroke or a heart attack. When people need an amputation, say they've got gas gangrene, which is very rapidly spreading and very dangerous, we can get them in the OR in 2 hours.
If we can get to people quicker and treat them the right way, we think that we may be able to limit an infection to either no amputation at all, or perhaps we might lose a pinky toe versus losing a leg.
I went to the doctor complaining of severe flu symptoms. The following day, I noticed the whole bottom of my heel, the skin had come off. It was a pretty severe infection, so if it wasn't for them, I wouldn't have a foot. I haven't walked in a long time, and there's been days where I get discouraged, but I come back here and they pick me up.
I had a small cut in the bottom of my foot, but I didn't really pay too much attention to it. I got pretty sick, and I got to the point where I couldn't even walk. I ended up coming to the hospital. They said it was infected. I went into surgery, and the doctor said, well, I'm gonna try and save your leg. I had 2 uncles pass away from the exact same thing. And the first thing I did was move the blanket to see if I had a leg, and it was still there. I don't think I would be here if it wasn't for them. I can do more things with my daughter. I can go outside, I can go for a walk. Before I couldn't do that.
We believe that this center really belongs to this community. We have the modalities right here. We have the x-rays right here. We have all these special machines under one roof. We have something which is called the Luna in the SPY. Normally, in order to study circulation, they come in and they do ultrasound. But with this machine, we can study the very smallest of vessels, but at the same time, not cause any kidney problems. Adventist Health, they decided to step up to the plate. And they have funded this center and given this gift to this Boyle Heights community.